All right, let's get this show on the road. Administration. You're going to prepare your operatory. Open the tank slowly, counterclockwise, and your oxygen first. Check your tank levels. Remember that the gauge on the oxygen tells you accurately the amount of oxygen in the tank. Not so with nitrous oxide. Use the oxygen flush button to fill the reservoir bag and have the flow meter on. Assemble the nasal hood. In our case, we have a nasal hood with a separate inner liner. Attach the conduction tubing and then connect the scavenger system to the HVE. Activate the scavenger system and adjust the setting. The scavenger should be pulling at 45 liters per minute. How you'll know that is it's adequate when you can hear suction. So when the suction is audible, your scavenging system is adequate. Go ahead and place the patient in a supine position, not lying completely back, but torso slightly reclined, legs slightly elevated. Start your oxygen at 100%. Again, your reservoir bag is filled with oxygen. Please have the oxygen flowing before you put the nasal hood on the nose. We don't want our patients not breathing. We're going to estimate a liter per minute flow. Let's start at 6 or 7 liters per minute for a tidal volume. Place the nasal hood over the patient's nose and have them adjust it for comfort. You want to make sure that they're not feeling any air blow out underneath the nasal hood on their eyes. That could dry out contacts. In addition, that also allows the escape of nitrous oxide gas into the environment, which we don't want. We don't want any kind of gas escaping on the lip either. So we don't want them to feel any kind of air blowing out around the nasal hood. You may have to adjust the conduction tubing a little bit to do that. And now let's determine the proper tidal volume for your patient. The patient should be comfortably breathing through their nose. So ask your patient to take nice deep inhales and exhales through their nose. Takes a few minutes for this. Take a look at the reservoir bag. Is it full? Is it huge? Is it bulging? 6 or 7 liters is too much for that patient. Reduce the tidal volume. So reduce the amount of oxygen you're administering. We're only administering oxygen at this time. Nitrous oxide flow has not started. Is the reservoir bag collapsed? I mean, is it flat as a pancake? You're not giving them enough gas. And your patients will tell you if they're not getting enough gas, if they feel like they need more air. Then increase the oxygen that you are administering. Once you and the patient have found that comfortable spot where they can breathe comfortably in and out of their nose, you're noting a slight movement of the reservoir bag, sort of mimicking the patient's respirations, you have achieved their tidal volume. Again, for most adults, 6 to 7 liters will be adequate. It's now time to start nitrous oxide. You're going to begin your nitrous oxide administration by turning the nitrous lever up to 1 liter, and you reduce your oxygen by 1 liter, maintaining that tidal volume you have determined. Again, encourage your patient to breathe through their nose and limit their conversation. Nitrous oxide in our environment as the provider comes primarily through patient talking. So we want our patients to limit their conversation. After 1 minute, you're going to assess the patient response. Are they starting to feel relaxed at all? Probably not after 1 liter. And so now you're going to adjust the doses in half-liter increments with a minute pause between adjustments. So now nitrous is up to 1.5 liters, and you've reduced your oxygen down by another half liter. And you continue to increase nitrous by a half and decrease oxygen by a half until you see those signs and symptoms of minimal sedation. Onset comes quickly. And again, it's generally 30 to 40% of nitrous oxide that's ideal for most patients. So typically this takes about 3 to 5 minutes. You've got to give some time for the effect of each dose to take place before another dose is given. You know that nitrous oxide gas is relatively insoluble, so it does head to the brain quickly, but we do need to allow time for titration. The percent of nitrous oxide oxygen being given to the patient must be put in the dental record. We'll talk about that in a separate audio. You're going to see a floating ball in the flow meter. The number associated with the floating ball doesn't indicate the percent of nitrous you're delivering. So in other words, if the ball is at 2, you are not delivering 20% nitrous oxide. You actually calculate the percentage of nitrous oxide you're delivering by dividing the maximum nitrous you are delivering by the entire tidal volume. Let's imagine you have determined your patient's tidal volume to be 6 liters, and you have achieved sedation with the nitrous at 2 liters and oxygen at 4 liters. 2 plus 4, you have maintained that 6-liter tidal volume. To calculate the percent of nitrous oxide being delivered, you divide 2, the amount of nitrous you're delivering, the maximum amount, by the tidal volume, 6. You're now delivering 33% nitrous oxide to that patient. Again, we'll talk more about that. So you're looking for this ideal sedation. Maybe the patient feels warm throughout the body, hands or feet might feel numb. They're just relaxed. Again, look for those eye indications too. So blinking less, maybe a glazing of the eyes, just a general chill feeling. When the treatment is complete, it's time to recover. You can start to decrease nitrous oxide incrementally depending on the phase of the treatment. In other words, if you were you have completed maybe your most aggressive scaling and root planing, and now things are a little bit less invasive, you can decrease that incrementally. Or if you're nearing the end of treatment, you are getting ready to polish, turn off the nitrous. We now begin the postoperative oxygenation period of 100% oxygen. Postoperative oxygen must be delivered for a minimum of 5 minutes. So just go ahead, turn the nitrous all the way off. You don't have to do it incrementally like you started it, so just turn it off and put your oxygen back to what you determined the tidal volume to be. During this 5-minute post-operative oxygenation phase, or recovery oxygen, that we can also call it recovery oxygen, complete the treatment you're doing, or if the treatment is done, go ahead and take those post-operative vital signs. Go ahead and take your post-op blood pressure and pulse. After 5 minutes, after you've timed that 5 minutes recovery oxygen, ask your patient how they're feeling with the nasal hood on. Patient tells you they're back to normal. Terrific. Take the nasal hood off, turn the oxygen off, and allow the patient to breathe room air. Let them know everything went well. They are ready to head out. So no need for a driver, no precautions. They can go back to school or work or home. If the patient is not feeling back to normal, I still feel a little something. Maybe 5 minutes post-operative oxygen wasn't enough. Again, remember that biologic variability. So provide a few additional minutes of oxygen or as long as necessary. So use your best judgment. So we provide that oxygen until the patient feels that they are back to normal. There are some complications with sedation. The number one potential negative side effect is nausea and vomiting. Of course, there's a concern of aspiration when someone vomits, diffusion hypoxia, and/or airway obstruction, some complications associated with sedation. As nitrous is terminated, nitrous oxide quickly diffuses into the alveoli and is exhaled, and nitrous oxide is exiting faster than the oxygen replacing it. That dilutes the oxygen blood supply in the blood, reducing our blood oxygen saturation. Normally, 14% oxygen is present in alveoli, but in the first few minutes after termination of nitrous oxide oxygen gas, it may have been diluted to 10%, so diluted down. We can't just have patients breathe atmospheric air right away. They must have that 5 minutes post-operative oxygen. If they just went straight to atmospheric air, again, large volumes of nitrous oxide have been removed. This actually, more carbon dioxide is removed from the blood, lowers the carbon dioxide tension, reduces the stimulus for breathing, produces a depression of respiration. Patients get nauseous, they get headachy, they get tired, lethargic. We don't want any of that. So we provide them 5 minutes of oxygen post-operatively. Diffusion hypoxia is more often seen with pediatric patients. You won't be seeing pediatric patients, so that should not be an issue. And airway obstruction can be caused by oversedation, that obstruction being the tongue. This can be quickly reversed with the termination of nitrous oxide and the administration of 100% oxygen. So you're going to use the correct titration technique and avoid oversedation. When you're done, turn off the unit at the master switch, turn off the gas cylinders, turn off the HVE, disinfect and sterilize the equipment. Separate the inner liner from the mask. Wash the nasal hood and liner in warm water with a detergent. Oftentimes there's a little makeup that gets stuck on those. We'll rinse with water and dry them. Both are steam autoclavable or chemical vapor sterilizer, okay. Dry heat sterilization and chemical disinfectants like Cavicide should not be used. Cavicide sprayed onto the inner liner or on the outer hood, of course, tends to discolor it, but that chemical gets impregnated in the plastic and actually starts to give it a little bit of a smell or an odor that patients will notice. So no chemical disinfectants on that nasal hood or inner liner. We're going to wash it with soap and water, and then we're going to autoclave it. You can put a big clear bag over the flow meter as a means of protection against aerosols and splatter. We're not going to have any aerosol or splatter when we administer in clinic because we're not providing any treatment. Any part of the tubing that's not corrugated can be sterilized. Corrugated tubing cannot be sterilized. That we will use, again, soap and water to clean. Note the documentation that you must have pre and post operative vital signs, the concentration of oxygen, peak concentration of oxygen and nitrous administered, your tidal volume, the total liter per minute flow, the length of time that you had the patient sedated, how long they were on recovery oxygen, their recovery status, any kind of post-operative instructions you gave, patient's response to the sedation. Here's a sample for you to read. Any questions, let me know. There's a video in Blackboard you can watch as well. It's about 20 minutes long, but it'll help. Thanks for listening, and we'll see you soon. Bye-bye.